It's a time etched in the memories of many people in our city, especially healthcare providers. 15 years ago, the world was told to stay away from Toronto due to SARS. That's when the World Health Organization issued an advisory warning travelers to stay away from our city. 44 people in Canada would die from SARS, about 400 became ill, and 25,000 Toronto residents were placed in quarantine. It may seem like a lifetime ago, but the lessons learned from that era are now being applied as hospitals in our city rebuild. Toronto Western Hospital here redesigned their ICU recently with SARS in mind. Meanwhile, another Toronto hospital is starting from scratch to help keep future outbreaks at bay. Change is in the air and shovels are in the ground at Michael Garron Hospital. Today, the East Toronto Hospital unveiled its grand plan for its $411 million renovation. Almost every centimeter of the facility's redesign and expansion will be about infection control.
I was actually frontline back then.
Kirsten Martin is heading up the redesign after seeing the virus's spread firsthand.
So what we're moving to is a hospital that has 80% private rooms. And that's a huge advancement because really contact, contamination between patients is limited when you have one patient per room.
In the city's West End, some of the SARS lessons are already in place at Toronto Western Hospital.
We actually use some of those lessons learned to help influence the way that we designed that isolation section or pod.
These pods allowing staff to safely put on and take off protective gear in an adjacent room. Just one more step to stop the spread.
It's all under negative pressure isolation, which means that we're able to control the direction of the flow of air so that it contains anything that could be an infectious particle within that pod, and it won't go outside of that pod and may cause infections in other patients.
It's hard to believe it's been that long.
Following the SARS crisis, Dr. Brian Schwartz helped write the manual on how healthcare facilities manage infectious diseases. When you look back and reflect about how far we've come, are you proud or do you think there's more to do?
Both. I think we're both proud of the fact that we have come a long way in prevention of disease transmission, not just in hospitals, but in long-term care settings and with the public, with messages to stay home when sick, to cough into your sleeve, to wash your hands after you cough.
What we're seeing here is what you can do when you start from scratch.
From outbreak to design to build, it's an exciting time in this city's healthcare industry because one of the things Toronto does best is rebuild after crisis.
It's amazing to be able to start with best practice. So everything is built with best evidence that we know of to help keep people safe. I think what's critical though is we don't build alone. So it's really about our partnerships with other hospitals in Toronto and elsewhere.
The ICU here at Toronto Western was completed in 2007. Michael Garron, meanwhile, will be completed in phases. That new 8-story patient care center is set for completion in 2021. Meanwhile, the entire project is set to be done by 2024. Amanda Ferguson, City News.